My name is Dr. Walter Fernyhough, naturopathic doctor. This is a brief introduction to the video, Understanding the Diagnostics of Hypothyroidism. If you're new to hypothyroidism, this video may be a little long and maybe a little difficult to understand. If you already have somewhat of an understanding of the diagnostics of hypothyroidism and are just looking for more information or clarification on some of the things that are used to diagnose hypothyroidism, then this video might be better suited for you. Either way, if you decide to watch this video, I hope it provides you with some valuable information. Today I'm going to talk about the diagnostics of hypothyroidism. I will list some of the main symptoms that I see, along with some of the signs and the labs that may be ordered to help with the diagnosis. Thyroid hormones are responsible for the rate of metabolism, and low thyroid means slow metabolism. The symptoms of low thyroid include fatigue, especially first morning fatigue, cold body, cold hands, cold feet, weight gain or the inability to lose weight, dry skin, dry hair, hair loss, foggy head, memory issues, depression, constipation, and puffy face and joint swelling, especially in the morning. The clinical signs we see with low thyroid include loss of outer third of eyebrows and or eyebrow thinning, slow Achilles reflex return, low body temperature, and low pulse pressure. If the body temperature goes below 36.4 degrees Celsius 3 hours after waking, this is considered an indication of low thyroid. The pulse pressure is the difference between the systolic and diastolic numbers in a blood pressure measurement. Low or high blood pressures by themselves are not good indicators of thyroid function. It must be noted that the absence of any or all of these signs does not eliminate the possibility of hypothyroid. The labs we might see to help us with our diagnosis are TSH, T3, T4, reverse T3, and the antibodies thyroid peroxidase antibody, thyroglobulin antibody, and thyroid stimulating hormone receptor antibody. TSH is the first hormone you might see. In fact, within the standard medical system, it may be the only hormone you might see. TSH is a hormone from the pituitary gland, produced by the brain to stimulate the thyroid gland to produce thyroid hormones. Some thyroid hormone experts would say that TSH is a fairly accurate reflection of thyroid hormone levels about 95% of the time. This does not mean that it is an accurate reflection of thyroid hormone activity, as there is a difference between thyroid hormone levels in the bloodstream and thyroid hormone activity. The optimal level for TSH is between 0.3 and 2.5 MUs per liter. Most labs show a range with an upper number of 5 or 6, but this is too high. Anything above 2.5 MUs per liter suggests hypothyroid. For someone taking thyroid hormone supplementation, the TSH accuracy to reflect thyroid hormone levels drops to between 50 and 70%, meaning that 30 to 50% of those taking thyroid hormone for their hypothyroidism can no longer trust TSH to be an accurate reflection of their thyroid hormone levels. T4 and T3, usually measured as free T4 and free T3, are the actual thyroid hormones. T3 is the active hormone, and T4 is thought to have a small amount of activity but needs to be converted to T3 to be fully active. T3 and T4 are not a direct measure of thyroid hormone activity, but a certain level needs to be available in the bloodstream to attain a certain level of activity. The optimal levels vary depending on the lab and the type of treatment being administered. As a general rule, the free T4 should be at least mid-range, and the free T3 should be close to the top of the lab range. Reverse T3 is a mirror image of the T3 molecule and can only be created from T4. Reverse T3 blocks thyroid hormone activity and transport of thyroid hormone, especially T4, into the cells. With high reverse T3, all of these hormones, T3, T4, and even reverse T3, can build up in the bloodstream and show elevated levels on a blood test even though thyroid hormone activity is suppressed. The body's cells have the enzyme to create reverse T3, but the brain cells that read thyroid hormone levels in the bloodstream do not. This creates a disconnect between what would be considered optimal TSH levels and optimal thyroid hormone activity. According to a study done by Dr. Kent Holtorf, medical doctor, many can have what would be considered normal levels of TSH, T4, and T3 in the bloodstream, or even elevated levels in the case of T4 and T3, and have cells that are not expressing sufficient levels of thyroid hormone activity, thus creating hypothyroid symptoms. In these cases, reverse T3 is a better determinant of thyroid hormone activity than TSH, T4, and T3 by themselves. A higher level of reverse T3 without an increase in TSH can occur with insulin resistance, diabetes, depression, bipolar disorder, high cholesterol and high triglycerides, chronic fatigue, fibromyalgia, neurodegenerative diseases, migraines, stress, anxiety, chronic dieting, aging, and environmental toxins, including heavy metals, pesticides, herbicides, and plastics. It can also occur due to testosterone deficiency, growth hormone deficiency, progesterone deficiency, cortisol excess, and estradiol excess. According to Dr. Holtorf, the ratio of free T3 to reverse T3 should be above 0.2. Unfortunately, the Alberta labs no longer offer reverse T3 measurement, so if we want to get this measurement for Alberta patients, we need to send a sample to a US lab. Thyroperoxidase, thyroglobulin, and thyroid stimulant hormone receptor antibodies are all considered reflective of autoimmune disorders. In the case of low thyroid, it would be called Hashimoto's thyroiditis and would include high thyroperoxidase and maybe high thyroglobulin antibodies. These antibodies would then be considered the cause of the low thyroid. It must be noted that in most cases of Graves' disease, which causes hyperthyroidism, these antibodies will be elevated as well. The cause of these autoimmune conditions are unclear, but there are many possible causes, including certain foods, toxins, and cortisol deficiency. The diagnosis of hypothyroid or low thyroid is not dependent on any one symptom, sign, or test, but is best diagnosed if a collection of symptoms and signs are present, lab testing is performed, and ultimately a trial dose of thyroid medication is completed. And that's it for my introduction to the diagnosis of low thyroid. I hope this was helpful. Thank you for listening. Goodbye.